afternoon and welcome to the webinar for the Interdisciplinary Research Leaders Program. My name is Mandy Labreche and I work as the Program Manager for IRL, and I will also serve as your moderator for today. This webinar provides an opportunity to learn about the Robert Wood Johnson Foundation's Culture of Health Vision and Leadership Development programs, to understand the Interdisciplinary Research Leaders Program and the current funding opportunity, to understand the application process for funding, and to ask questions. Before I get into the introductions, I just wanted to remind everyone about a few housekeeping notes for this webinar. We ask that you please submit any questions that you have through the Q&A button. Your name will be attached to your question unless you hit the anonymous button, and all questions and answers will be seen by all attendees in this webinar. We'll do our best to get to all of your questions, but if we don't get to you, you can always email the IRL email account, which is researchleaders@umn.edu, and we will respond over email. And also, this webinar will be recorded and available on the IRL program recruitment website early next week. Our presenters today are Nancy Fishman, Senior Program Officer with the Robert Wood Johnson Foundation, Michael Oakes, Director of the Interdisciplinary Research Leaders, or IRL program, Adriana Barriotes, Co-Director of IRL, and Sarah Gaulis and Ezra Goldberstein, who both serve as Associate Directors for the IRL program. It's important to note that Michael, Adriana, Sarah, and Ezra are all on faculty here at the University of Minnesota School of Public Health, which is where the IRL program is housed. We've also invited one of our current IRL teams to speak about their experience in the program. Vanya, Michelle, and Tish are on the line and will share about their experience in IRL a bit later in this webinar. I will now turn it over to Nancy Fishman from the Robert Wood Johnson Foundation, who will provide an overview of the driving vision for this work, creating a culture of health in our country. Go ahead, Nancy.
Thanks, Mandy. Good afternoon. The Robert Wood Johnson Foundation is the largest national foundation devoted exclusively to health. At RWJF, we're working alongside others to build a national culture of health. Our goal is to help raise the health of everyone in the United States to the level that a great nation deserves by placing well-being at the center of every aspect of life. Building a culture of health means to create a society where every person has a fair and just opportunity to live the healthiest life they can. And equity really matters. To embrace a more integrated, comprehensive approach to care, thank you, and requires unprecedented collaboration with everyone playing a role. Next. So what are we thinking about when we talk change leadership? We've been in the leadership business for a long time, for the 40 years of the foundation's history, and our vision of leadership has expanded greatly over time. We're looking for visionary leaders that bridging health care and non-medical factors that influence health. So this is the larger change that has happened over the 40 years of our foundation. We're looking for leaders who embrace change, adapt, and innovate in a rapidly evolving landscape in our communities. And we're trying to create a network of leaders across sectors, professions, and perspectives. Lastly, we want to engage champions well-positioned to move the nation towards a culture of health. So what do our leaders look like? They know how to prioritize health equity, diversity, and inclusion, to work across sectors, and they're willing to embrace lifelong learning. We look for our leaders to be at all levels of their career. And we want those people to be interested in real impact and taking leadership in their influence in their work environment and community to the next level. So we have created at the foundation 4 different leadership programs that I'll very briefly explain here, but I encourage you, if you're interested in any of the other programs beyond interdisciplinary, research leaders to look at the website, Change Leaders, that's at the bottom of this slide. So our health policy research scholars is aimed at second-year doctoral students. And what we're looking for is all sorts of academic disciplines, and then to imbibe their experience with a health policy lens, so that we're really bringing multiple views to our mission to create a culture of health. Our culture of health leaders is really a program that's a leadership development program for leaders from all sectors in the community. And it's based and grounded in principles of equity and social justice. Clinical Scholars, which is a long-standing program at the Foundation, has expanded and changed quite a bit. And it is now a leadership development program that offers interprofessional teams. So you have to come in as a team of people, of health professionals, spanning a wide range of disciplines, please, and gives them the opportunity to build and develop unique skills to lead teams with and across communities and organizations. And last but certainly not least, the interdisciplinary research leaders that you will hear about today, where we're looking for both community members and researchers to come together. And I will leave it to the rest of my team to explain this program.
Thanks so much, Nancy. Hello, everyone. Good afternoon. This is Michael Oakes speaking. I'm really pleased to share information about our National Leadership Development Program called Interdisciplinary Research Leaders. For short, we call it IRL. It's a tremendous opportunity for teams of researchers and community leaders to come together to create a healthier, more equitable life in America and communities of health and so forth. Across the country, researchers in health and many other fields that influence health are exploring opportunities to redefine communities, systems, policies. And community leaders are pursuing new approaches in education, faith, not-for-profits, government, policy, social service, culture, housing, and so many others in order to improve health equity. The Interdisciplinary Research Leaders Program brings together researchers and community partners, aimed to equip them with advanced leadership skills and focus on health and equity. Together, we aim to break down silos, address health disparities, and build fundamentally healthier communities. We want to build bridges between the myriad of factors that have enormous influence on people's health. Things such as education, neighborhood, transportation, income, faith, and so forth. It's the culture we're ultimately seeking on, and ultimately a culture of health equity. I dare say the IRL program is quite novel and quite, ingenious in a way. We're bringing together communities and researchers. We have a true collaboration. There'll be no principal investigator, which is a traditional term for some research leaders. It's true collaboration. Importantly, we want to develop leadership skills to enhance impact. And of course, we want to attract and cultivate new, diverse leaders. These are people who may not have had a seat at the table historically. We want to elevate them and bring them forward. So this is the groundbreaking program we aim to create and keep going to do catalytic research that's collaborative and impactful. It won't surprise you that while the University of Minnesota is the home of the National Program Office, we have many fantastic partner organizations in particular for this slide. One is Isaiah, which is a local Minnesota faith-based organization with roots and connections all over the country. And of course, Academy Health, which you might know is I dare say, the premier health policy advocacy group. And they all do tremendous work, and them and other partners really keep us focused and moving forward. Let me tell you a little bit about the program at a high level, and my colleagues and friends will share more as we go forward. First, this is a 3-year fellowship program. So I want to be clear that it's not a traditional research grant for you researchers, it's a fellowship program. As I mentioned a minute ago, we want to equip teams with research skills with a clear focus on action for health equity. We want to create leaders in research. So yes, be a research leader, But importantly, both the community partner and the research leader, we aim to be leaders. So when a community partner may not be a researcher, her or himself, we want them to understand research, direct research, and ultimately help us do better research. So while you'll see in a few moments there is a actual research component to this fellowship, the IRL is both a leadership development and a research program. And I want to make sure you're clear on that. It's not just a research grant as some of you might have typically understood. So some elements, and I'll speak more about this as we go forward. Key elements, teamwork. Within your team, your 3-person team that applies to us, we want to have teamwork. We want to have teamwork across the cohort of teams that are selected. And of course, teamwork throughout the IRL program, including our alumni. We want you to be connected with the other 3 major leadership programs Nancy Fishman mentioned a few moments ago. So teamwork is key. Leadership development and training. There's not enough emphasis these days, I think, in research leadership. We focus on that a great deal here. What does it mean to be a research leader? What are the tools one needs? Importantly, I put the community leaders in that same camp. How can they require ethical research in their communities and so forth? We have a fantastic curriculum you'll hear more about in a few minutes. We focus on research methodology, policy, and dissemination. We want to address these problems from an interdisciplinary perspective. Of course, that's in our name. We want to do community-engaged, action-oriented research. So it's research with an eye on doing something. Many of us, including me, are very interested in basic research, but in this case, this is research for action. Again, as I mentioned, we want to have collaboration across all 4 of the major programs, as well as the Robert Wood Johnson Foundation more broadly, and obviously a strong and active alumni. Please. So what will you be required to do? Well, we ask that you devote about 1 day a week on average. You know, sometimes we have a trip for a few days. Other times there'll be nothing to do in that week. So 1 day a week on average for the IRL program. And we're sincere about that. I don't want it to be any illusion. We're looking for about 1 day a week. It doesn't have to be the same day, but about that many hours. Typically on Friday afternoons, if you're in the East Coast time zone, we want to have a weekly webinar where we share and learn and do all those kinds of things. We have an active online discussion of a pretty amazing platform. We have web-based mini courses, sort of like a YouTube thing that we want you to go through. We have within and between team and program collaboration opportunities. You'll be asked to do a research project. That's a focus of your research activity within IRL. And we have, depending on what year, 2 to 3 meetings in person per year. So importantly, in this IRL fellowship, you don't move to Minnesota as much as we'd like to have you, but you can sort of stay where you are and join us through the internet. But we do like to meet 2 or 3 times a year, and those are sort of required meetings. So you'll be part of a cohort as you apply and are selected. This will be cohort 4, the 4th cohort for the IRL program. We expect to select and enroll 15 teams of 3 people each. As I said, the teams are comprised of 2 mid-career researchers and 1 community partner. I'll come back to this. And again, as I mentioned, no relocation. You get to stay in your house and just join us a couple times a year for a trip. What do we offer? We offer annually $25,000 through generosity of the foundation per fellow per year. So $25,000 for your time in the IRL. This is money that we offer you in order to participate in the IRL program, the webinars and so forth. So that's true for everyone for every year. In addition, we offer your whole team a total of $125,000 research grant. So your research project should have a total budget of about $125,000, or I should say up to $125,000. That's different from, on top of, if you want, the $25,000 fellowship support. I'll note that some places, often universities and colleges, will require a overhead on that. I want to be clear that the total budget for you will be $125,000, and we only give $25,000 per person per year. You can negotiate with your universities. We ask that they waive that, but every place is different. In addition, for your trips and other things we might ask you to do, we pay for all your travel expenses, airline and hotel and all those normal business things. We offer access to an amazing team of mentors and other kinds of professional development activities that I think lots of people enjoy. Well, a little nitty-gritty. Who or what is a mid-career researcher? We don't have very rigorous boundaries on this because different people have different lives. So this is a difficult thing to define, and we know it. We're looking for a researcher with experience doing excellent research. You might be someone with a PhD who's sort of approximately 5 years out of your PhD, and you're not going to be retiring within 10 years. So clearly a broad definition of mid-career. You can't be a graduate student or a postdoctoral student or a trainee. So if you have an NIH-K award or something similar, you're not eligible. Importantly, both applicant researchers need to be mid-career. You can't average. You can't have a very young and a very old person and say on average we're about right. Both researchers are mid-career. Now, you might have questions whether you in particular are mid-career enough for us. If you meet those criteria, you are, and I would just say, go ahead and apply. If you have some questions, I invite you to send an email. We'll get right back to you. We might say you're not eligible or you are eligible, and we ask that you make the case for our reviewers. So there are some people on the margin. We recognize that. Let us know by email if you have a particular question. Otherwise, make the case that you're mid-career. How about our community partner? They are also difficult to define, and I think that's a wonderful thing. We're looking for someone who works in and with communities, someone who's embedded and knows about and works for the ultimate persons we're trying to improve health with. It's this kind of person who's embedded in their community of knowledge, their community of people, their community of culture, that are working with them in some capacity in order to improve their health and well-being broadly defined. So the community partner may work in a variety of organizational settings. They could be working for a local not-for-profit. They could be working in government of some form. They could be working in all kinds of jobs. But we want their experience to be germane to the proposed research project, and we want them embedded in the community. As I said earlier, and this matters to us, we want that community partner on the team to be an equal member of that team. We want her or him to become a research leader, someone who understands research, someone who, again, defines research, gives access, and talks about ethics of research and so forth. Again, a high level, what will your experience be? This little diagram has sort of 3 levels of a cake, the more pinkish, the purple, and then the lower blue. In the first 6 months of the program, from September to approximately December, you'll be working on refining your research protocol, which is what you submit to us, and we approve your research project, but we're going to ask you to do an even better job once you're in the program. We'll give you some help to refine it. At the same time, you'll be learning about translation of that research project into good things, including action. It might be policy change or whatever it might be. So one of the interesting things about the IRL program is we're thinking about dissemination and action from moment one. It's not an afterthought to research project, but it's baked into the whole point of what we're doing. And of course, all along for your first 2.5 years, you'll be getting what I hope is wonderful research and leadership training. Going back to the pink, in the mid 2 years of the program, you'll be focusing on your research project. That's the approximate $125,000 budget thing I'm speaking of. And of course, you'll be thinking about how to disseminate that and do good things with that work. In approximately the last 6 months of your program with us, you'll be focusing mostly on translation and action, taking your research project into the community, into the policy circles to affect change. Then, hopefully, you graduate and you become one of our fantastic alumni and part of the larger network of really amazing people doing great work for the rest of their career. So a quick summary. Again, I encourage you to see the call for applications, or CFA, which is attached to our recruiting website for all the details. Obviously, read that carefully. But simply, apply as a team of 3 persons. We're looking for researchers from different disciplinary perspectives. Novel interdisciplinary partnerships are desired. I can tell you I've been on lots of interdisciplinary grant reviews. Sometimes I've noticed a professor of English classical literature saying that I am different from the professor of English, earlier literature. And that's true unless you're a chemist. So we're looking for novel teams, maybe a civil engineer and a computer scientist, a health economist, and a psychologist. You get the idea, truly interdisciplinary teams. The team is expected to be fully collaborative and offer a cohesive vision and demonstrate their ability to work together equitably. Oddly, there is no principal investigator. You all are together. Of course, some legal rules. Each team member must be a U.S. citizen, permanent resident, or individual granted DACA status at the time of the application. Now it's my privilege to pass the baton to my co-director, Andriana.
Thank you, Michael. My job is to talk about the IRL opportunity for community leaders. First, I want to frame what we mean by community building and community development, particularly as it relates to social determinants of health. And this is important as we get into the 2 themes for this call for application. As Michael noted, the community partners may come from a range of organizations and institutions, be they nonprofit, faith organizations, or public agencies. But also, as we define community, it may be place-based, serving neighborhoods, a city or town, or perhaps a region, or you may also be from organizations serving specific populations. The focus of the work may be community revitalization, utilizing a range of strategies focused on physical and economic development, which are often fundamental to community development. It may also be people-focused, which includes strategies improving local economies through workforce development, job creation, or enhancing small businesses. Financial capability of families and individuals are an important component to these strategies, and recognizing that there's a growing body of evidence related between wealth and health. Lastly, human and social capital development. Community partners may be devoted to community building strategies that are focused on improving these connections, or engaged in community organizing, civic engagement, policy advocacy, and other, in addition to enhancing human capital through training and education. So we're really looking for a broad range of community partners who may be working in a variety of sectors. So the value of IRL to communities, I believe, are really some real high-level activities for our partners. And I think this is something that's been a growing piece of our learning across the program, that we understand as communities that there is a strong need for growing research partnerships and skills in this field, and to be able to understand and convey the impact of this work. Far too often in our partner organizations, research and evaluation is funded as a special initiative or with soft philanthropic resources, making it oftentimes much more episodic. Relationships with researchers may be strong and consistent in some cases or communities, but for others it may be out of reach or driven by those outside the community. The social determinants of health framework has strengthened or created new partnerships with healthcare and public health for community development and community serving organizations, but understanding what that means and what works and how to advance this work is certainly emerging. The Because the IRL is also a leadership development program, we believe this is a great opportunity to further develop those relationships and skills. And community-based partners bring a lot as equal partners to the team. As an example, we're inviting our team from Baltimore who's going to share a little bit about their research project. Before we do that, I'm going to do a quick introduction of Vanya, Michelle, and Letitia, and a little bit about their research, and then we'll give them a few minutes to describe their work and experience with the IRL program. Vanya Jones is an assistant professor in the Department of Health, Behavior, and Society at Johns Hopkins Bloomberg School of Public Health. She researches injury prevention intervention to reduce the burden of injuries in vulnerable populations. Michelle Bacote-Jackson is the Senior Vice President for Youth Development and Social Responsibility at the YMCA in Central Maryland. She has expertise in program development and implementation that addresses individual behavior of at-risk youth. And lastly, Letitia Ryan is a pediatric emergency medicine physician and an assistant professor in the Department of Pediatrics at Johns Hopkins University School of Medicine. As a child health researcher, she focuses on injury prevention and child health disparities. Their research is focused on youth violence and evaluating curriculum for group mentoring. And as I mentioned, they're going to take a few minutes to talk about their work and the experience with the IRL program and opportunity. I'll turn it over to you all. Thanks.
Thanks. We were actually asked to answer a couple of questions in order to get us started. So I want to start by, this is Vanya Jones, by the way. I want to start by saying how we decided to join the IRL program might be of help to you. So Dr. Letitia Ryan and I were working together on youth who were peer assault injured and going to the emergency department. So the lay term for that is they were fighting with another kid and they got hurt bad enough that they went to the emergency department and required medical assistance. And what we discovered is that and what research says is that there's a large recidivism of that. And we had been doing some work in that area and learned a lot. We learned about things that worked, we learned about things that didn't work, and we wanted to try and move some work forward with a partner that serves older youth and had the privilege of talking to Michelle at the Y. I'm going to let my teammates actually answer the same question because they have slightly different reasons why they chose to join.
Good afternoon, everyone. This is Michelle Bacote-Jackson, and as Vanya said, they reached out to us at the Y to provide the mentoring part, and timing was actually perfect for us because as one of the largest youth-serving organizations in the Central Maryland region, we had literally just taken on the role of becoming the local Big Brothers, Big Sisters affiliate. So talk about timing meaning everything. So we were more than prepared and poised to take on the mentoring opportunity and also to be a part of research that as a community organizer, as a community-based organization, we were really enticed by the fact that this is research that comes out of the Petri dish and actually goes live. So while we are learning and growing and learning about the work, we're actually doing the work, and that is helping our young people to not get into this mode of recidivism around youth violence prevention. So we saw it as a wonderful opportunity.
And hi, everyone. This is Tish Ryan. I have some of the same thoughts as my colleagues, Vanya and Michelle. Just on a very practical level, we were forwarded a call for applications from IRL by our mentor, and we were really struck by how it sounded like such a great fit for us in terms of it being a team of 2 researchers and a community person. And, the timing was right. And it also would allow us to kind of have a relatively quick turnaround in terms of being able to improve our program for youth, as well as study how the changes worked. And unlike many other funding mechanisms, would also give us some additional training in interdisciplinary leadership and teamwork.
So part of the experience of this is really working as a partner and how we work together as a partner in a partnership. I think is really important to the IRL program. That makes it, you know, an issue when it comes to the researchers and the community, and how do we work together, and what does each party get out of the type of work that we do. I'm a public health researcher. I've been working in public health since the start of my career, and one of the things that I do is program evaluation and program development. Understanding the experience of the people who are implementing these programs if they become live is extremely powerful to creating a program that actually works. And I have gotten so much from Michelle and Tish in thinking about, from a medical provider to a community person and a leader, how I should consider the work that I do. So a lot of what I bring is the evaluation strategy, but a lot of what I get is how it actually is going to work and what are some things we need to consider.
Great. And to tack on to that, as the community partner, as community partners, we quite frequently get the opportunity to implement evidence-based practices and policies and procedures, but rarely do you get to be on the end of the actual research. So that was extremely appealing to us and very rewarding, and is continuing to be as we continue into the years 2 and 3. It was also wonderful to be able to talk to current funders in the spirit of renewal and attract potential funders, because again, we are now connected to this extremely valuable and thoroughly multidisciplinary research process. And to be brutally honest, it doesn't help a Y, which, you know, granted has some pretty good branding reputations out there, but it certainly doesn't help to have us be connected with a Johns Hopkins physician and a professor. It certainly adds another layer of credibility to our work, and quite frankly, to our region and our city.
And as you know, as the physician on the team, as a researcher who's mainly hospital-based and rarely gets outside of those walls previously, I've really benefited so much from having a better understanding of the perspective and the needs of our community partner. And, you know, over this process, we've come up with so many other ideas of how we can work with the Y to help the youth that we treat in the emergency department. So that's honestly been really awesome.
And lastly, we were asked to share a little bit about what each of us brings to the partnership. Like I said, I bring sort of the public health context, but we do a lot of training together. As Dr. Oak sort of mentioned, we have meetings that we go to, we have seminars that we do, that all of that time together is, you know, sort of thought-provoking work. But the other thing that I think I bring to our team is a lot of laughs. We spend a lot of time laughing. We spend a lot of time trying to make the work we do relevant in our lives. So I think one of the other things that I bring to the team is a little bit of levity in what we think is really serious work.
I ditto that. It's in addition to Michael's requirements. We screen for sense of humor, and if you did not make the cut, you were not a part of this team. So this is how we got to the top 3. As Vanya said, this is extremely rewarding work. It is very hard, and you have to have a sense of humor in order to get through, and a team that gets it, that gets the work and gets your sense of humor. In terms of technical, what I bring to the partners, the partnership is obviously the community connection. We bring the mentoring program, which includes all of the professionals, all of the systems, and all of the wonderful children therein. And of course, we're the Y, so we got buildings, we got space, we got places, and we have opportunities to easily convene when and however we need to.
I want to thank Vanya, Michelle, and Tish. We're going to keep moving on to the curriculum, but you can see there's a lot of rich experience through this program. So I want to thank, and they'll be on a little bit longer for the Q&A. So with that, I'm going to turn over to Sarah Gallus, our Associate Director for Curriculum.
Thank you. So I want to return to this figure, which kind of guides the sort of helps you with the symbol of the program, which again, I'll emphasize is both a research grant program and a leadership training program. And to that end, we have a pretty robust curriculum that you'll undertake in our goals of having you be the next research leaders who can help build a culture of health in the United States. So the curriculum is designed around this goal, again, to produce leaders in connecting innovative, rigorous, relevant, team-based research that can be used to stimulate action and policy settings to build a culture of health. So with that goal in mind, the curriculum has 4 main interwoven threads. You'll see in 4 colors. On the top left is collaboration and community engagement. You heard it from our team in Baltimore, how seriously we take the team dynamics, the ability to facilitate effective ethical research and community partnerships across diverse disciplines and sectors. And we assist you and support you in that work for community engagement, both within your local communities as well as your own collaboration and communication as a team. The second curriculum domain is community change leadership, with the goal of understanding the issues facing your communities and how to build and lead movements to create change that will promote health equity and build social justice. Another pillar of the curriculum is around policy and communication. We think that through a solid understanding of the policy-making process, we can help build your skills to communicate research outcomes to achieve your objectives, in whether that be changing policy or practices in your organizations and communities. And finally, both rigorous and relevant research is extremely important to us, that you're going to be applying scientifically sound methodologies, both qualitative and quantitative. And you'll hear a little bit more about the research side of the program from Ezra. So just to emphasize, Michael touched on these details, but just so you understand even more, the curriculum is delivered in a hybrid mode through both in-person and online formats. We have 3 annual gatherings in your first year and your third year, and 2 meetings in the second year of the program. We offer flexible online courses that you can take in the time that fits in with your schedule, regular webinars that offer the chance for your sharing across the cohort of your work in progress, as well as occasional professional development opportunities or guest lectures. And finally, you'll have mentoring available to each team to enhance your learning objectives through hands-on coaching, advice, and assistance on the research, policy, or communication issues that your team needs the most assistance with. So I want to emphasize that the curriculum is not learning for knowledge's sake, but actually to apply these skills into your research project, which ends up like the capstone for applying your skills, whether they be newfound skills in planning, in team coordination, in using social media. You'll get the chance to apply those research, action, and translation skills on your IRL project. So Ezra is going to take it away with a more detail on the specifics of the research project component of IRL.
Thanks very much, Sarah. The IRL program has several components, but it's ultimately a research program, and the research project will be the centerpiece of the IRL experience. A key feature of the IRL program is that we are looking to support research that has a high likelihood of driving action and change in communities and policies. IRL is seeking to support rigorous, high-quality research, but we are also interested in supporting diverse types of research. We want diversity across the IRL teams in terms of the study populations, in terms of scientific disciplines, and in terms of research methodologies. This means that we are interested in both qualitative and quantitative research, but also in a variety of research designs, including the types of studies that are listed here on this slide. Going back to our diagram of the program experience, when prospective IRL teams apply to the program, they sketch out a proposed research project. For the teams that are accepted into the IRL program, the first 6 months of the program will be dedicated to refining and planning the specifics of their research projects, which culminates in a proposal to the program office that lays out the specific plan and the specific resources needed to execute the project. The research project will then run for 2 years, after which the focus will shift toward communicating and translating the results to effect change. It's worth noting 2 things that the IRL program is not aiming to support. First, This is a research program. It is not intended to support program implementation or program development per se. Second, this is not the traditional model of academic research where you do an investigator-initiated study, publish your results in an academic paper or a journal, and from there on, you're hands-off with what happens next. What we are looking to support is teams of researchers and community leaders who work together to define and implement rigorous research that will directly inform policy action and drive change from the level of the local communities the teams are working with, potentially all the way up to the national level. The Robert Wood Johnson Foundation's culture framework makes clear that many factors are important for improving population health and health equity. The IRL program will use this framework to focus on specific topic areas for each cohort, which will foster cohesiveness across the IRL teams and will enhance the ability to translate research findings into action. Each applicant team will identify the topic area they are working with, and each team will work within that topic area for the duration of the fellowship. However, all IRL teams will be interacting with each other regardless of the specific topic areas that they're working in. For this, the fourth IRL cohort, which begins in September 2019, applicant organizations will be represented by teams of 3 that will focus on one of the following research topic areas, one of which being community development and health, the other one being clinical practice, social services, and health. The topic areas for future IRL cohorts have not yet been announced, but they will fit within the Robert Wood Johnson Foundation's Culture of Health framework. Let's talk about the 2 topic areas in more detail. The first one is community development and health. For our purposes, we are defining community development as the largely nonprofit profit sector that provides interventions to improve low-income communities and the lives of the people who live in them. These interventions are primarily investments to help communities provide affordable housing, invest in healthcare facilities, schools, grocery stores, and other facilities to make neighborhoods more vibrant. Community development also fosters small businesses as a means of developing local entrepreneurs and creating positive spillovers that improve the local economy for all. The emphasis in community development is often on developing physical capital, but we want to be clear that our focus is also on efforts to strengthen social capital within communities, including by involving community residents in development efforts. There's a lot of research on associations between neighborhood conditions and health, but little of it is action-oriented and/or is community engaged. While there is some evidence that community development investments have improved a community's built and social and service environments, the relationship between community development and health remains largely unexplored or rigorously evaluated. Accordingly, we aim to generate research to support community development for health. Proposed projects should focus on direct and indirect community development efforts from community development financial institutions, which might include developers, bankers, hospitals, schools, and other anchor institutions or other economic stakeholders. Intersectoral efforts are highly desired by the IRL program. Setting this work apart from existing research is the community engagement feature, which is the foundation stone of the IRL program. While documenting problems is important, the IRL program is, once again, primarily interested in developing and testing evidence-based solutions. Projects that aim to improve health equity are always very highly valued in the IRL program. The following are three examples of research projects which may be topics of potential interest under this topic area. But I want to be clear, these are merely illustrative, and we welcome proposals from a range of topics and approaches, provided they are consistent with the language in the call for applications. So one example might be a quasi-experimental study of investment strategies designed to attract primary care providers to underserved communities. A second example might be a rigorous qualitative evaluation of a novel financing plan for grocery stores in low-income neighborhoods that lack access to nutritious food. A third example might be an experimental study where underemployed persons are randomized to either receive a skilled training program designed to meet local employer needs or a personal financial literacy and management program. Now we're going to move on to the second topic area for Cohort 4 of IRL, which is clinical practice, social services, and health. Under this topic area, we are looking for leaders who will conduct research projects focused on the relationships among and between clinical practice, social services, and health. We view medical services and social factors as playing very central roles in determining the health status of individuals and populations, but there is insufficient knowledge of and coordination between clinical practice and social services, particularly when it comes to vulnerable and marginalized populations. There are several different types of barriers to coordination and collaboration across these types of sectors. These can include legal, technical, or knowledge barriers, but they can also include barriers related to compensation and financial incentives, and also cultural differences across different types of service sectors or the healthcare sector. Accordingly, we're aiming to generate community-engaged research on solutions for better integration and alignment of clinical practice and social service systems. We're interested in the bidirectional nature of collaboration, which means that some projects will focus on how healthcare can better connect and partner with social services, while other projects may focus on how social service organizations can work better with their healthcare partners. Again, setting this work apart from existing research is the emphasis on community engagement and equity, both of which are really the foundation stones of the IRL program. Our working definition of social service systems includes the following areas: housing, income support, transportation, education, employment, food and nutrition assistance, child protection services, child and family support services, criminal and juvenile justice system. So in other words, a pretty broad conception of social services. Our working definition of medical systems includes all conventional areas of medical care, but we're especially interested in work around mental health and substance use disorder services and health, veterans health, pediatrics, and elder care. Medical homes and integrated healthcare delivery systems are not the explicit focus of this topic area, unless there is some that is within the context of having some explicit focus on another type of social service as well. So here I offer again 3 examples of types of projects that may be of interest to the IRL program under this topic area. And again, this is not to the exclusion of other types of questions, just 3 illustrative examples. One example might be a rigorous qualitative study into how system integration benefits not only medical providers, but also social service efforts. A second example would be a mixed method study of the strengths and weaknesses of metrics and tools for measuring successful integration in the context of a veterans administration system, working with local non-for-profit veteran systems organizations. A third example might be a quasi-experimental study of the success or not success of various reimbursement schemes designed to promote integration across sectors. And with that, I'm going to turn it over to Mandy to offer some more details on how to apply to IRL.
Regarding how to apply for this funding opportunity, each team of 3 individuals will submit 1 application. Applications must be submitted through the RWJF online system, and all applicants must follow the instructions and use the templates provided in the RWJF application system. Program applications are due on March 13th, 2019, and the application includes the following components: short individual essays, a collaborative statement from the team, a preliminary research description related to one of the 2 themes for the 4th cohort of IRL, biographical sketches, limited appendices, and applicant teams may choose to submit these limited appendices. Up to 15 teams will be accepted into the fellowship program, and with the help of IRL mentors and IRL leadership, teams will spend the first approximately 4 months of their fellowship refining their research proposal, which will be reviewed and approved by the IRL National Program Center. This shows you a screenshot of the application homepage in the RWJF online system. You will need to register in the RWJF online system and complete several questions. You will also download, complete, and submit the application templates for the various components in the solicitation. Each team will submit just 1 application. 1 person from your team should initiate the application and then invite the other 2 team members to contribute to the same proposal. We strongly encourage all 3 team members to log in as soon as possible so that everyone is aware of the application requirements. This screen shows you a timeline for the call for applications. So as a reminder, applications are due by 3 p.m. Eastern Time on March 13th. Here is a timeline, and it's also included in the call for applications document in more detail. And regarding the deadline, we would like to emphasize that in fairness to all applicants, RWJF's policy is not to accept any late submissions. And again, all applicants are strongly encouraged to log into the RWJF online system well in advance of the deadline to familiarize themselves with the application requirements. So we will now take questions from participants on the webinar. As a reminder, if you would like to ask a question, please type it into the Q&A box on your screen. We will read the questions out loud, but we won't identify the name or organizational affiliation. So while people are typing in their questions, we'll start with a few questions that were submitted in advance of the webinar. So one question that we get is, what are the expectations of the community partner?
So the community partner is expected to participate in all of the curriculum components and work with the research team to set the research agenda and be a contributing partner to the team. However, the team kind of defines that role. But it is expected that the community partner would participate in all of the webinars and in-person meetings, and as identified as the research project.
Thank you, Adriana. Another question that we commonly receive is, if I am a PhD student, am I eligible to apply as either the research partner or the community partner?
No, unfortunately, students are not eligible. If you're a second-year PhD student or going into your second year, you might be interested in the Health Policy Research Scholars, or HPRS program. But for IRL, we want mid-career researchers and community leaders.
A related question that we often receive is, can you define what a mid-career researcher is?
Yeah, it's a great question. As I said earlier, we have no super strict rules, but we're looking for someone with approximately 4 or 5 years post-terminal degree, often a PhD, research experience, and of course, excellent research, and someone who's not going to be retiring within approximately 10 years. So that's a wide swath. Importantly, if you're an academic, your rank, that is assistant, associate, or so-called full professor, doesn't matter much. We appreciate people have different ages at this, in these various ranks. So mid-career is someone about halfway through or in the middle part of their research career.
Thank you, Michael. Another question that we received through the Q&A is actually for our IRL Team Baltimore, Vanya, Michelle, and Tish. If one or all of you could describe what the leadership development training experience has been in the IRL program.
Sure. There are lots of components to the leadership training that we find very valuable. One of which I didn't think about as a leader, which is how you use social media. There was a whole session on how to use Twitter and what that means, and how getting your work out there to an audience that might be able to use it more sort of practically is something that you really should consider. So that was really helpful. I think one of the other things that we get are coaches. That's one thing that wasn't discussed a little here that has been really helpful. We have a coach for helping us, again, with that non-traditional communication strategy, like writing op-eds and writing sort of things that we don't normally write as researchers. And I think that's also been helpful for our community partner. She apologizes, she had to drop off for another meeting. And how we come together with one voice. We also have a coach that's helping us with certain new research methodologies around working with organizations. So the coaches have been really helpful. And those coaches, they don't come out of your budget. It's one of the things that they help provide as part of the structure of IRL. Tish, what would, I know you have other things that you think were really helpful as part of the leadership training.
Yeah, I think, I guess I would describe it as kind of both broad-based as well as sort of individualized, which I really like. There's curriculum on Fridays with webinars, other reading assignments that was mentioned in Michael's presentation, as well as sessions at the different conferences that we attend throughout the year. And some is, on more broad topics, I guess, like conflict management, kind of how to collaborate within a team, communication, equity, diversity, inclusion work, etc. But I was surprised when pleasantly surprised when, as Vanya mentioned, we were kind of asked what types of coaches would help you with your work. And through that, we've been able to get sort of very directed, individualized kind of mentoring / coaching on some of the areas that we identified. So we have sort of a mentor who has a national reputation and expertise in mentoring. We had someone who is assisting us with sort of recruitment, and as well as someone helping us with navigating social media and writing an op-ed, other things of that nature. So it's got this sort of broad, as I mentioned, curriculum, but also opportunity to kind of individualize to your own team's needs.
Thanks so much, Vanya and Tish. One other question is if the two research partners need to be based at a university?
That's a really great question. The answer is no. Technically, neither of the research partners need to be at a university or college. They often are, but we have plenty of outstanding fellows and expect many of outstanding fellows from, let's call them, research organizations or organizations that house researchers. So traditional academic research is not the only place researchers are. And in fact, those in the other kinds of places are of interest to us because often they're doing wonderful community engaged research.
Thanks, Michael.
There were a couple of questions about, from the community development standpoint, as to whether or not a CDFI needs to be involved, and that's a very specific definition for a type of organization, a community development financial institution. We absolutely could see CDFIs being eligible to be a community partner, but there are also other forms of community development types of partners, whether they're community development corporations, community-based nonprofits that may be doing more people-based service delivery. There was also a question about United Way. Again, if the community partner is engaged in and working with communities, it's about making the case that's relevant to the research question that we're most concerned about. So we're taking a very broad definition around community development and community-based services, and so we're happy to answer more specific questions after this webinar.
We have another very interesting question, actually two I'll address. The first one asks, can anyone on the team be a student, part-time, full-time, so forth, research partner, or community partner? The answer is maybe. I'm sorry, that's frustrating. If the student is a PhD student aiming to be a researcher, no, even if they want to serve as the community partner, because they're sort of pushing towards a research degree, and we want them to be a real community partner. Now, there may be some particular persons on the boundary of that. Simply send us an email if you might be that particular case. A community partner being a student might be more possible. Again, we want mid-career community partners, just like researchers. Let me emphasize again that the community partner is also mid-career, and we have a very broad definition of that. Unlike someone who might be 30 years old and finishing a PhD, the community partner might have 5 years of experience at age 30, for example. So the ages of community partners might be wider, but the point is both research partners and the community partners are mid-career, someone with some experience and not retiring anytime soon. Well, we're going to close up now. I want to thank you for taking part in today's webinar to learn more about the IRL program. It's such a privilege to work with these fantastic people here at Minnesota and beyond, and certainly the foundation itself. We hope you'll consider applying to become part of the next group of leaders to help us build a culture of health. I dare say it's an amazing experience where we all learn from each other and explore research and leadership and community engagement together. On our website, You'll find links to the online application, the so-called Call for Application, or CFA, and other documents. You can also sign up to be added to our email list and receive program updates and future funding alerts. On Twitter, we are at IR Leaders, and we're pretty active in the Twitter community, and you can direct message us if you like. So email, direct message, give us a call. If you have particular questions, we are more than happy to help you. With that, I conclude the webinar. You may now disconnect. Thank you. I wish you all better health on behalf of the IRL community. Bye-bye.